Welcome back. This program by Anthem not only involves a list of non-emergent conditions that could be severe and life-threatening, it also threatens the future of access to emergency medicine and care.
I'm not a doctor or nurse. I have no medical training. And of course, I would never second guess taking my daughter to the hospital if she needed emergency care, but I absolutely second guess myself now. You know, it wasn't an emergency. I was fine. I shouldn't have gone, you know, all of this, even though I felt like I was dying that day and I was insistent that my appendix was about to rupture. So it's kind of a double-edged sword, because you feel too stupid to make medical decisions for yourself, but also, you know, obviously you're too smart to determine, based on the layperson's perspective, I should have known better that it wasn't an emergency. So I'm kind of caught in the middle. If I ever need emergency care again, that I will go to my primary care, they will have to call an ambulance and they will have to force me into it. I'm not going to the ER anymore. This is a $12,000 bill. I mean, this is like a very large portion of the mortgage that I owe on my house. This is more than the student loan payments that I owe. I mean, it's a ridiculous number for the few hours of care that I received for them to not even cover it. Like I said, if my daughter's in an emergency situation, of course, you know, motherly duties first. I would absolutely take her and kind of bite the bullet on the payment, but I will never seek emergency care for myself. And I feel like that's really dangerous for a lot of people, because you may be in an emergent situation, but you're too afraid to go because you're afraid of that bill. And I even wrote that in one of my appeals, that, you know, you may have people who are having a stroke or internal bleeding. I'm not even sure if you know how you're having internal bleeding, but you may be facing these emergent situations and not know it and be too afraid to go.
The day that we went to the emergency room, I was glad we went and that everything was okay. And then when the bill came and you see that it's not covered and they don't think you should have gone, then there were a lot of doubts that should I have gone or not, should I have just ridden out the pain. I think when you pay every month, you expect a reasonable amount of care from them, and that then they're not going to make you go through a stressful and time-consuming process to fight for what seems like should have been covered. And we've talked to a lot of people since then, and they all felt like it should be covered. So we're in the process of a second appeal with Anthem to pay the bill, because it's just frustrating, and I think they should pay.
I feel like I don't need insurance. I just should just not pay. I pay a lot more than that bill was a year, to have it. And
well, it scares me, because I think
why have it if
people won't go to the emergency room when they really need to go to the emergency room. I mean, I really thought I was having a stroke. I'm not a medical professional, but my body was telling me there was something wrong and that I needed to seek immediate medical attention. People are going to die. Yeah. People are going to die. People are, number one, going to suffer. Number two, they're going to die. And they're just going to be so fearful. A lot of people are on fixed incomes and they can't afford a $4,000, $5,000, $6,000 ER visit. And if they wait to go to their primary care physician if it happens in the middle of the night and there's nowhere else to go and this is your only option, I'd rather them be safe than sorry. There's so many things that will trickle down from this that I don't think Anthem is even thinking of, especially when it comes to the elderly. They are on a fixed income, they can't afford it, and I just really think that it's going to trickle down, and they're either going to have to give up something or they're going to wait and it's going to kill them.
In the end, they would have all made the same decision based on their symptoms, and every health professional we have talked to agrees with their decision and need for urgent evaluation.
Yes, I think, the level of pain I was in, if someone else was in that level of pain, I would totally understand them wanting to go and seek treatment. And I think it's a little bit scary to have to sit at home and weigh the cost of what will this cost me if my insurance pays or if my insurance won't pay to seek medical treatment.
There is some judgment, I know, that's involved with what you do. If my kid's got a cold, they're going to go to the pediatrician.
They can wait. They can wait till the next day or so.
If they've got a snotty nose and it's clear,
so, it's not
then I'm going to wait and take them to the pediatrician. I'm not going to wrap them up at 12 o'clock at night and rush them to the ER for a runny nose. I mean, that's kind of common sense, but I still don't. Maybe that runny nose could turn into something else. I don't know. I can't diagnose.
Maybe this is where it's all coming from. The insurance company wants to stop that, but your case definitely is not like a runny nose.
No.
I can understand people going to the emergency room for a cold is nonsense, and I'd want to stop that.
But if they have 105 fever, and it's, you know, at night, I'm going to take them to the emergency room. You know, I can't diagnose what's happening with somebody, and I don't think they should expect me to be able to diagnose what's going on with myself or anybody else, including my children or my mother or my father. That's neglect. That's pure neglect. It's absolutely pure neglect to do that, because like I said before, if you have an 80-year-old woman and she is in trouble and she cannot refer back to something that says, oh, they're not going to see you for, you know, they're not going to see you in the emergency room because this complaint's not on the list, that's neglect.
They forget we're the customer. We're
Yeah.
paying them.
We pay them.
Yeah, I mean, it's not
They're
fair to the
supposed to
customer.
take care of us.
And Kim feels like the insurance industry should be held to the same requirements and standards and expectations as the emergency departments and physicians that are providing the care.
Why is Anthem not held to the same standards as the emergency room? Is it because your hospitals are privately owned, aren't they? Well, then they should be held to the same standards.
Right.
Absolutely.
Yeah.
If you are a customer and you are paying for care, then they should be held to the exact same standards as the emergency department. No questions asked.
Who gives them,
Hands down.
Who gives them the authority to decide
Exactly.
you're covered, you're not? Oh, this is on the list now. Yeah. Yeah. Well,
Wait a minute,
yeah,
I take back this
yeah.
thing about this list. Wait a minute. If hospitals are required to treat people no matter what, and a consumer pays an insurance company money to take care of them when they need medical attention, then they should be held to the same standards as the hospitals. No questions asked.
One of the keys to the access to emergency medicine are laws establishing the Prudent Layperson standard. This states that a reasonable layperson who feels like they have an emergent medical condition have the right to access emergency departments for their care, and insurance will cover that evaluation. Unfortunately, Anthem is using some Monday morning quarterback skills to deny a visit that was found not to be an acutely life-threatening condition at discharge, but no way that the patient would have known that before they went to the emergency department. This has the potential to make people second guess, delay, and is potentially against the law. There are a few things you can do to help protect yourself. First, never delay an evaluation if you feel you have a truly time-sensitive emergent medical condition. Second, if you feel like you have time, call the insurer or primary care physician. They can help direct you to the right level of care. Also, if they refer you to the ER, let the medical staff know. Anthem states they will cover the visit if you are referred to the ER. This needs to be clearly documented in the chart as well. Third, appeal the denial. The idea of this program is that many will not fight and Anthem can keep those profits. Continue to appeal your claim. Ensure they completely review the chart, document your prudent layperson concern, and don't back down. Finally, work with the hospital and provider groups. The bill you are seeing is an elevated number designed for the severe undercuts that government and insurers provide. You have the right to negotiate just like these insurance companies. Most hospitals and physician groups will be happy to work with you on a reasonable rate and payment schedule. Interestingly, this program by Anthem does not involve children, care provided on Sunday, or customers that are extended distances from any care option other than the emergency department. If you have a claim that was denied, contact us and send us your story to info@StantonMD.com. We want to continue to collect and tell these stories so policymakers and insurers will put a stop to these programs and protect the rights and access of patients to emergency care.